Hello and welcome everyone to today's webinar. We'll give it a few minutes to let people continue to trickle in before we get started. All right, so hello and welcome to today's webinar on the evolution of mental health in the workplace. My name is Morgan Sayak and I'm a Senior Program Manager here at the National Safety Council, and I will be moderating today's webinar. This webinar will be recorded and sent to all registrants shortly after the presentation. During the webinar, attendees are able to pop questions into the chat or Q&A where we will have time at the end to answer these. I'd like to welcome today's guest speakers, Caitlin Lang, a Senior Research Associate, and Jenna Richardson, a Senior Program Manager, both at the National Safety Council. Today's presentation will provide an overview of the SAFER program, as well as, can you go to the next slide, Claire, please? We'll provide an overview of the SAFER program, mental health trends in the workplace, and the impacts of mental health, along with stigma and the role of leadership in the workplace, along with some resources and tools that can be utilized for you all. With that, I will kick it over to my colleague, Caitlin.
Thanks so much, Morgan. Like Morgan said, I am Caitlin Lang, Senior Research Associate here at NSC, and I work on the SAFER project. Now, if you haven't heard of SAFER, we began at the beginning of the pandemic out of necessity as a task force comprised of people from public health, different government agencies, and mainly businesses of all sizes across industries to come together and figure out best practices for protecting workers during those early phases. In January of 2021, we entered a cooperative agreement with the CDC and received funding to expand research activities and things like that. So in the beginning, we kind of focused on things like masking guidance, vaccination, and since then, the program's really evolved to address all sorts of topics coming out of the pandemic and beyond, sort of the future of work, and things like hybrid and remote work arrangements and challenges there, as well as more emerging topics like mental health and wellness, that as well as DE&I, that have been around for a long time, but some of them have been sort of exacerbated by the pandemic. Next slide, please. So the way that we have been conducting research, mostly most of our data comes from nationwide surveys of both workers and employers, as well as some targeted interviews with employers. Those have been the main sources of data for generating our research insights, as well as reports and employer guidance materials that are available on our website. The surveys targeted full-time working adults across all industries, and the employer surveys likewise aim to gather data from a broad range of industries, all business sizes, and just a broad range of sectors, as well as the interviews and case studies focused on industry-specific sectors and other relevant workplace demographics. Next slide, please. So today I'll be describing some of the key takeaways from these findings when it comes to mental health and workplace safety. So, for example, we know that mental distress can heighten the risk of workplace safety incidents. Our survey data highlights that there's a potential bidirectional nature of this relationship between safety and mental health. So, for example, the extent to which our survey respondents, full-time workers, felt safe at work strongly predicted their mental health outcomes. The survey assessed 3 distinct types of workplace safety: their physical safety, their overall sense of physical safety, safety specifically when it came to COVID-19 a couple of years ago, and psychological safety. And those who felt unsafe at work in any of these 3 areas were 2 to 3 times more likely to experience frequent symptoms of depression or anxiety. Now, as there's been a general rise in mental health issues throughout the pandemic, employers have noticed an increase in safety incidences or absences, which are related to poor mental health or substance misuse. Half of the large employers that we surveyed reported that they'd noticed a measurable increase in incidents related to mental health or substance use during the course of the pandemic. Next slide, please. So these and other takeaways I'll be going over today. Most of the findings come from our survey of 1,500 full-time working adults between the ages of 18 and 65. We collected this data in late 2023, early 2024. The participants were recruited through random dialing of cell and landline numbers using a randomized sample that is demographically representative of the US. And participants also had the option to take the survey in English and Spanish, or Spanish. Next slide, please. Now, the survey covered topics beginning with COVID-19, such as whether they'd had it, their history of infection, their vaccination history, and their risks they faced on the job of catching COVID. And then other physical workplace safety factors, such as their specific physical safety risks that they may encounter on their day-to-day job, as well as psychological safety and psychological hazards. We also asked them if they had sustained any on-the-job injuries at their current job, where they had to receive either medical attention, time off work, or both. There were also questions from the Total Worker Health WellBeing survey or questionnaire, which is a survey developed by NIOSH as part of their Total Worker Health program, as well as mental health screeners for depression, anxiety, alcohol use, and substance use. And we also asked them about their employee assistance program or other well-being benefits that they had access to at work. Next slide, please. And just for your information, since there wasn't a specific psych safety questionnaire available, we used questions from the WellBeing and other sources of these 9 questions. The survey respondents were asked to rate how strongly they agree or disagree with 9 statements related to psychological safety on a 5-point Likert scale. And it did show good internal reliability. Next slide, please. Okay, so the relationship between psychological and physical safety was significant. And when employees feel psychologically safe, they're more likely to report hazards or near misses and unsafe practices without hesitating or without fear of retribution. So these proactive behaviors can prevent accidents and injuries and create a safer environment. And also, psychological safety tends to foster a culture of continuous improvement, where workers actively participate in identifying and mitigating potential risks. So these findings were that survey respondents who felt psychologically unsafe at work were actually 80% more likely to also report that they had been injured at their current job and needing medical attention or time away. When it comes to remote and hybrid work, there's evidence that remote work provides a more psychologically safe environment for some workers, particularly those who've experienced or encountered discrimination or microaggressions at work previously. Interestingly, our survey results suggest that this sort of protective factor didn't hold for hybrid workers. So in-person and hybrid schedule workers both experience similar levels of lower psychological safety than fully remote workers. Next slide, please. So not surprisingly, psychological safety also impacts mental health and well-being. Survey respondents who felt physically or psychologically unsafe at work were 2 to 3 times more likely to experience frequent symptoms of depression and anxiety disorder within the past 2 weeks at the time of taking the survey. And in our one of our last surveys we did of employers on a large scale was in 2002. And just at that point in the pandemic, over half of the employers with over 250 workers, slightly, medium to larger size businesses, had noticed an increase in mental health or substance related incidents during the pandemic. Next slide, please. And although the overall physical safety and heightened COVID-19 risks and other things like that are correlated with adverse mental health outcomes, our data suggests that the mental health impact of the pandemic disproportionately affected individuals in high-risk jobs for COVID-19 infection and pandemic-induced job pressure as well. So this group primarily includes essential frontline workers, especially those in healthcare, public-facing roles, and education. So respondents working in healthcare settings reported the highest frequency of anxiety symptoms, followed by those in public-facing roles and education. This aligns with broader findings that healthcare and frontline workers have consistently reported elevated levels of burnout, emotional exhaustion, anxiety, post-traumatic stress disorder, and depression throughout and since the pandemic. So while various factors in workplace safety, psychological safety, work environments, and job functions may contribute to the negative impact of all types of stressors in different industries and occupations, these findings suggest a distinct impact on mental health and well-being exists in workplaces that were particularly, or occupations that were particularly affected by pandemic stress, potentially warranting tailored approaches within specific industry sectors. Next slide, please. So in addition to addressing physical health and safety, survey respondents completed 4 mental health screening questionnaires focusing on symptoms of depression, anxiety, alcohol misuse, and substance misuse. Aligning with recent findings in general population studies, the Safer Worker Survey identified widespread negative outcomes among these participants. Now, the depression screener we did is the public health questionnaire, the PHQ-8. It's a subscale of the public health questionnaire, which omits a 9th question about self-harm. So this version is validated to screen for depression in non-clinical populations. And then the GAD is Generalized Anxiety Disorder Screener, which is also a validated measure to screen for those. And then in this survey, I used sort of a modified CAGE-8 screener because typically this is a typical screener you may see at a doctor's office. But I separated the questions about alcohol and drug use in order to explore the prevalence and impact of each, because typically those questions are all lumped together. So, so there were 2 separate screeners for alcohol and then other drugs. And then within the past 2 weeks, half of the respondents reported clinically significant symptoms of depression, which with 30% reporting of those reporting moderate or severe symptoms. And again, this isn't, in a clinical setting, this is all self-report, but it is concerning that, our survey respondents were indicating such a high frequency of depression and anxiety. A similar pattern was observed with anxiety symptoms there. Next slide, please. So when asked about their current drug or alcohol use, a higher percentage of individuals using drugs or other substances reported experiencing problems at work compared to those who use alcohol only. Although current alcohol consumption was more prevalent than other, excuse me, than other substance use, those consuming alcohol were less likely to exhibit warning signs of alcohol use disorder. So for instance, among the 70% of survey respondents currently who consume alcohol on a somewhat regular basis, 1 in 5 acknowledged that their alcohol use had caused work-related issues in the past 6 months. But in contrast, only 20% of respondents reported current substance use, but half of them reported that their substance use had caused problems at work in that same time frame. Next slide, please. So as mentioned, Earlier, there is a correlation between poor mental health outcomes in workplace safety and injuries, as evident in our survey respondent sample. So, for instance, those reporting minimal or no symptoms of depression had the lowest past workplace injury rates, while rates increased for groups with worse depression or more frequent depression symptoms. A similar pattern emerged between injury rates and anxiety symptoms, ranging from 13% for respondents with minimal or no anxiety to 36% with those with moderate to severe symptoms. Now, importantly, this does not imply any sort of causation in either direction. Poor mental health does increase the risk of injury, or at least it can, due to cognitive effects or the possibility of medications causing impairment. But injuries have also been found to increase the risk of mental health problems such as depression. Next slide, please. We observed a similar relationship between scores on the alcohol and drug use screeners and a more prominent association between severe misuse and a history of workplace injury. So while only a small percentage of respondents overall showed signs of severe substance use disorder, 3/4 of those individuals reported a history of workplace injury at their current job. Now, it's important again to emphasize this doesn't imply causation in either direction. Of course, the use of impairing substances can increase the risk of incidents, but sustaining an injury may also result in an individual being prescribed pain management medications or other things that could lead to continued use. Next slide, please. So as I've kind of stated, the mental health and well-being of workers has suffered throughout the pandemic, and employers that we'd surveyed were noticing and responding, many of them, to meet the increased need for supportive interventions. So of employers that we surveyed, 40% had noticed an increase in mental health or impairment-related absences, incidents, or accidents during the pandemic. That was actually higher for the medium to large size employees who have or employers who have a larger sample size. It was 50% had noticed these increases. Now, of employers with an EAP, 1 in 4 had implemented that employee assistance program for the first time, and 60% had expanded EAP offerings during the pandemic in response to a greater need for EAP resources that they'd observed during this time, either things like workers requesting services or concerns being brought up by supervisors about their direct reports, or again, just a clear increase in incidents. Next slide, please. So a concerning yet expected discovery by NSC and other researchers throughout the pandemic is the persistently low utilization of EAPs, despite the increasing need for interventions. So although many employers are expanding EAP coverage or offerings, it's important to ensure that employees are aware of the available services. So a majority of our respondents to our worker survey reported that they did have access to an EAP at their current job, just over half. Well, nearly a third did not, but 15% didn't know. So it's important to get those offerings out, advertised and know what's available. So while the return on investment we know is in worker well-being is high, as Jenna will be getting more into in detail, there is a need to sort of assess the effectiveness of employer interventions to maximize the potential help and support available. And not only that, but getting the resources out and get them utilized by any employees who need them. So NSC and others have found that many employers responded to the pandemic by expanding or implementing new offerings. And even of those who didn't exchange offerings, a majority did make some sort of change, such as promoting the EAP services to help raise awareness about the benefits available to workers. So with greater visibility and utilization, of course, EAPs can play a significant role in bolstering the resilience of workers and workplaces. And now to get a little more into that, I will pass it over to Program Manager Jenna Richardson from NSC's Wellbeing team to discuss mental health in the workplace and employer interventions. Thank you so much.
Thank you, Caitlin. So I'd like us to transition now into discussing mental health in the workplace and the overall trends that we've been seeing in the last few years. But I'd like us to first start with a quick true or false game. So talking about mental health at work increases the likelihood of workplace violence. Please feel free to put your answers in the chat or just think about each one as we go along. So this answer is false. Encouraging mental health dialogue promotes safety, inclusion, and early intervention. The next one is workplace stress has no measurable impact on physical safety. True or false? And this one is also false. So stress can significantly impair concentration, reaction time, decision making, increasing the risk of workplace accidents and injuries. The next one is 1 out of 5 adults in the US experience a mental health illness each year. True or false? And this one is true. So approximately 1 out of 5 US adults live with a mental illness in any given year. And this highlights how common mental health challenges are, not only in the workplace, but in our communities. And the last one is providing mental health support in the workplace has been shown to reduce absenteeism and improve productivity. True or false? And this one is also true. So studies show that mental health initiatives can increase engagement and reduce costs associated with lost productivity. Next slide, please. So to really provide context of addressing mental health in the workplace, we really need to zoom out and look at the mental health crisis at large that's happening in our communities and often in our own homes. So mental health isn't just about mental illness. It's not just diagnoses and crises. It really encompasses the total emotional, psychological, and social well-being of individuals. It impacts the way we think, how we feel, how we act, how we interact with others, how we handle stress, how we show up to work. And just like physical health, it can change over time, sometimes dramatically, sometimes quietly. Right now, 1 out of 5 adults in the US lives with a mental illness. But that doesn't include the millions of individuals that are struggling silently with a mental health challenge, but they don't seek help due to due to stigma or fear or whatever it may be. So what does that mean in the context of work? Next slide, please. So 76% of US workers have in the last year expressed that they experienced at least one symptom of a mental health condition. That is a large chunk of our workforce. In fact, that's the majority of our employees. Yet many organizations still treat mental health as a side issue when we know it's a central safety issue and it should be a strategic workforce issue. Additionally, 84% of workers say that the workplace itself, workplace conditions contributed to their mental health challenge. And what that shows is that it's not just personal stresses, it's not just personal issues that are being brought into the workplace, but it's the workplace itself that is contributing to these mental health challenges. And so, in other words, if the job is part of the problem, if the workplace is part of this problem, it can be part of the solution. And we'll get a little bit more into those solutions later on. But the main message here is that these aren't just personal issues, they're workplace issues. Next slide, please. So how does this impact productivity for your organization or your business? Research has shown that workers with poor mental health miss, on average, 12 more days per year than their peers, totaling to around 48 billion in lost productivity from mental health challenges alone. But what about employees that show up to work with a mental health challenge, but they're physically there, but they're not mentally there, what we call presenteeism. And so maybe they're showing up, but they're drained, they're distracted, they're disengaged, they're having a hard time focus. So presenteeism has actually been shown to be more expensive than absenteeism because it's harder to detect and it's harder to manage. It shows up as reduced performance, costly mistakes, and according to Gallup and other resources, 1 in 3 employees has reported that their productivity has suffered due to their mental health. But usually what the response is when one of our employees' productivity suffers is that manager or employer provides more pressure, maybe more oversight, a performance management plan, and not really addressing the real issue, which is the unaddressed mental distress. And all of that just adds more stress and makes the problem worse. So we'll discuss better approaches and solutions later on, but addressing the root problem is the major takeaway, and prevention is key. We really can't afford to ignore mental health. So next slide, please. So let's connect the dots between mental health and workplace safety. When we think about traditional safety risks, things like slips, trips, falls, equipment misuse, we tend to focus strictly on the physical hazards. But what safer research and supporting research and lived experience shows is that psychological hazards are just as real and just as important to address. In fact, feeling unsafe at work, whether physically or psychologically, is directly associated with negative mental health outcomes. And those negative mental health outcomes, they loop right back around and they increase physical safety risk. In fact, the highest rates of workplace injuries are among workers who report stress and anxiety. And some studies show that more than 50% of workplace injuries are connected to underlying mental health challenges. When people don't feel safe psychologically, like Caitlin mentioned, they're less likely to report near misses. And that silence creates a dangerous blind spot in our safety programs. So it's important to remember that even if your workplace is physically safe, if it's not mentally safe, if it's not psychologically safe, it's not truly safe. And as long as we continue to treat mental health as separate from safety, we're leaving a major risk unaddressed. Next slide, please. So let's zoom in now on the specific ways that mental health issues show up as safety risk in the workplace. The first is chronic stress. Chronic stress is one of the most common and most underestimated hazards that we face. It's ongoing, it's relentless, it's cumulative, it changes our brain chemistry, it affects our immune systems, it drains our ability to make rational decisions. And because it is one of the most common hazards that we face, I'm going to go a little bit more into detail in the next few slides about stress in particular. But for now, we'll shift to substance use. So for many people experiencing chronic stress or mental health challenges, they more often than not turn to substances as a way to cope. So it might be alcohol, stimulants, sedatives, and it might start as casual use, but usually it escalates quickly or can escalate quickly. And we know impaired workers are unsafe workers. And fatigue is very similar in nature as another silent risk factor. Mental distress or an employee that's struggling and feeling mentally overwhelmed often has trouble sleeping. And so if you have an employee showing up to work with 4 or 5 hours of sleep every night, night after night, eventually they're operating at a level of impairment equivalent to alcohol intoxication. And finally, and probably one of the most important, is risk recognition. When someone is mentally overwhelmed, their ability to detect and assess danger is compromised. They may overlook red flags, they may underestimate hazards, they might forget to take precautions, even ones that they've taken 100 times before. And that leads to real consequences, injuries, near misses, safety violations. So it's important to remember that it's not just an individual behavior, it's about systems. So our systems designed in a way to account for cognitive and emotional fatigue? Are your incident investigators asking, was stress a factor? And are we training our teams to think holistically about what might be going on beneath the surface? So instead of treating mental health as something separate from safety, we need to view it as a predictive indicator. If you know your team is going to be under a high level of stress, especially for an extended period of time, you should expect an increase in risk. And it's our job as leaders and safety professionals to really plan and adjust and provide support for that risk. So to wrap up this slide, mental health really impacts safety every single day. And the more we understand those links, the better we can prevent harm. Next slide, please. So according to the National Workplace Health Data and reaffirmed through safer research, work is one of the most significant sources of stress for adults in the US. It ranks right up there with financial strain, caregiving, and health concerns. And in the workplace, this can look like shorter attention spans, delayed reaction time, poor hazard recognition, increased likelihood of making dangerous mistakes. When people are constantly stressed, they aren't in a high performance state. They're really in survival mode, and that's not a safe place to be working from. 54% of adults say that work stress impacts their home life and their ability to rest and recharge. So when someone is experiencing that stress for an extended period of time, their nervous system is constantly activated. Their cortisol levels are up, their inflammation increases, their sleep is disrupted, their cognitive functioning declines, turning into a real safety issue and a performance issue. So when left unaddressed, this stress can snowball into burnout, into higher injury risk, into higher absenteeism, and into higher turnover. Next slide, please. So what is driving all of this stress at work? It's definitely not just one thing. It's a mix of structural problems that show up every day at work. So for instance, job security fears keep people in that survival mode. And fear of retaliation silence workers and and that silence is really dangerous. Constant change without support causes exhaustion. Work-life blur makes it really, truly hard to disconnect and recover. And performance pressure, feeling like you're never good enough, imposter syndrome, all of these. Employers can't eliminate all stress in the workplace. That's not feasible. But what we can do is we can design work and systems and policies in a way that reduces unnecessary harm. And the first thing that you can do is ask your team, ask your employees what's stressing you out the most and what would help. And these answers can really provide a blueprint for that change. We'll explore now how stressors show up in the body and behavior and the early warning signs of burnout and distress that we can't afford to ignore. Next slide, please. So the real life signs and symptoms of mental distress, these show up in the workforce long before someone quits or burns out. And as employers and leaders and safety professionals, we are often in the best position to notice these early warning signs. And that early detection is one of the most powerful tools that we have for preventing harm, whether it's workplace injury, a crisis, or a resignation. So what some of the most common indicators, first is the emotional and behavioral signs. So these are the things that we can often chalk up to somebody having a rough week or a rough day. But if they persist, if it's a pattern, then it's a signal. So some of this can look like, is someone showing up more irritable than usual? Are they withdrawing from team conversations? Are they showing signs of apathy or numbness? Are they arguing more with coworkers or just seeming more on edge? So these signs and symptoms, they don't really come out of left field. They usually stem from an unmanaged stress or mental distress. Next are the physical signs. These may be a little bit more obvious. So changes in appetite and sleep patterns or constant fatigue, or even just showing up with more frequent minor illnesses. We know that our bodies and our minds are very much connected. And so over time, that mental strain often manifests physically. And the last is these cognitive symptoms, like difficulty focusing and forgetfulness and trouble making decisions, slower reaction times. These signs can show up as subtle at first and can be easily missed or misinterpreted if we're not really actively looking through a mental health lens. I'm not saying we have to start diagnosing our coworkers. That's not our role. But what we can do is when we notice a change, we can check in. So we can simply ask something along the lines of, hey, I notice you seem a little bit less engaged in our meetings. Is something up? And sometimes that small moment of acknowledgement is the opening someone needs to really feel seen and supported. The key here is to normalize these conversations. So if someone broke their arm, you wouldn't ignore it. You wouldn't tell them to power through. But when someone is clearly struggling mentally, we often stay silent, maybe out of discomfort or maybe out of fear. But that silence creates isolation, and that isolation is what's really dangerous. So we really need to train our teams to recognize these signs, not just our leaders. Peer awareness is powerful. Sometimes a coworker is more likely to notice these signs and symptoms than a manager. Next slide, please. So let's talk about the benefits of fostering a mentally healthy workplace. Next slide. This isn't just a feel-good initiative. It's really a performance strategy, a risk mitigation strategy, a retention strategy, and a safety strategy. When mental health is actively supported in the workplace, we see lower burnout, higher morale, stronger retention, and greater workplace satisfaction. When people feel like they have the resources and the support to set boundaries and rest when they need it, they're less likely to hit that wall of burnout. When employees feel valued, not just for their output, but for who they are as people, they engage differently. They show up more fully and they collaborate more openly, and that drives performance. And then employees who feel psychologically safe, who feel that they can speak up and ask for help, are more likely to stay with the organization and contribute in a meaningful way. So mental health, it's also not just about improving individual well-being, it strengthens community well-being as well. Because a mentally healthy employee goes home, is more present with their families, is a better friend, a better parent, a better partner, and that ripple effect can really change entire communities. And another huge benefit is increased productivity. So a mentally healthy employee doesn't just show up to work. They're more focused, they're more creative, and more resilient. Next slide, please. So we talked about the human case, the safety case, and the performance case of investing in mental health. But now let's talk about the business case, because while empathy and values drive some decisions, we know that return on investments drive most others. So for every $1 invested in mental health support or treatment for your employees, there's a $4 return on investment and increased productivity and improved health outcomes. This number is based on national and regional data on absenteeism, presenteeism, healthcare costs, and productivity loss related to mental health. It ranges based on region and sector, but in general, as Caitlin mentioned previously, the return on investment is great. Next slide, please. So to really capture this return on investment for your organization, there's this free, easy to use online tool that allows you to calculate the specific financial impact that mental health has in your workplace based on your own work size, industry, and state. So if you feel like it right now, please feel free to go to nsc.com or .org, I'm sorry, nsc.org/mental health at work, and we can kind of walk through together how this works. Next slide, please. So first you enter some basic information about your organization, the location, the number of employees, and the industry. And then the calculator is going to run those numbers using the national and regional data on absenteeism, presenteeism, healthcare costs. And next slide, please. What you get in return is a breakdown of how much untreated mental health conditions are costing your business every year. So in this example, I used a national organization with 500 employees in the entertainment and food industry. The calculator gives you insights into where you stand to save by improving access to care, reducing stigma, and promoting early intervention. So it's a very powerful way to make the case for a mental health program to your executive team or your finance department. It really translates empathy into economics and helps bridge that gap between what we know is right for people and what makes sense for a business case. So again, it's very useful when proposing like a new EAP or enhancing existing services or making the case for supervisor mental health trainings or justifying mental health days or flexible scheduling, or even when trying to secure additional funding for a wellness program. So if you haven't used this tool yet, please write down the website, nsc.org/mental health at work. It's quick and it's free, and it really helps you frame the financial impact that mental health is having in your organization. Next slide, please. So additional cost to employers, on average per employee annually, a mentally distressed worker costs an employer over $4,700 a year in extra missed days. They cost over $2,800 more in healthcare services per year compared to their peers, and result in over $5,700 a year lost due to turnover alone. Next slide, please. So overall, mental health support and treatment for employees lowers overall medical costs. It lowers absenteeism and increases productivity. It leads to lower burnout and stronger retention and greater workplace satisfaction. Next slide, please. So let's look at the big question of what does a supportive culture around mental health actually look like? Next slide, please. So according to recent trends, what we know is that 92% of workers say it's important to them to work for an organization that values their emotional and psychological well-being, not just one that offers benefits or talks about resilience, but one that actively creates a culture of support. In fact, workers rated healthy, supportive work cultures as more helpful than therapy. That's huge. That's what that says is the work environment itself has more impact on someone's mental health than an external therapist or an app. Yet, only 1 in 3 employers currently treat mental health as a top priority. So that's a major and serious disconnect, and one that has real consequences for safety, engagement, and retention. Your workplace culture is really what is going to fill that gap or widen that gap. So some practical ways to start thinking about building a supportive culture. First is normalizing mental health conversations. So don't wait for Mental Health Awareness Month. Make it part of your regular safety talks and performance conversations, and train your leaders. Your supervisors really set the tone. If they model stress management and vulnerability and empathy, others are going to follow. If they dismiss mental health concerns or joke about them, that too is going to become a norm. Empower peer support. So consider peer advocate programs, mental health first aid trainings, or even informal buddy systems. Sometimes it's just easier to talk to a coworker than a boss. And then build feedback loops. So ask your employees what's working and what's not, and then act on it. Because listening without following through, that erodes trust. But asking and listening and adjusting, that's really what culture. Next slide, please. So we've arrived at one of the most persistent and damaging barriers to mental health in the workplace, which is stigma. So despite all the awareness campaigns, all the stories shared during the pandemic, stigma is still one of the main reasons that people don't seek help. And it's still one of the most difficult challenges to overcome because it lives in our language, our assumptions, and even in our own policies. 74% of employees agree it's acceptable to discuss mental health at work, yet only 58% feel personally comfortable doing so. So that 16-point gap is between what we say and what we actually feel is huge. And what's more troubling is that workers' comfort with discussing mental health at work has actually decreased since 2019. And that means we're losing ground. So what is stigma? Next slide, please. There are actually three types of stigma. Public stigma is society's negative attitudes toward people with a mental illness. Structural stigma is policies or practices that disadvantage people who disclose a mental health challenge or mental health illness. And self-stigma is when individuals internalize this shame or feel weak for needing help. And all three of these show up in the workplace. And what it does is it makes people wait too long to get help. It keeps people from acknowledging their own needs. It reduces EAP utilization, and it really fosters a culture of silence where people suffer alone and in secret. Next slide, please. So now that we talked about how stigma shows up, let's talk about what we can actually do about it. So one of the most effective strategies is to model openness from the top. When leaders say, I've gone to therapy or I've experienced burnout too, it normalizes the experience. And leadership really sets the tone. If mental health is never talked about at the leadership level, then the entire organization takes cues from that. The second is providing training and education. So busting myths like mental illness is rare or people should just toughen up is essential. So challenge the stereotypes and misconceptions that people might be carrying by providing ongoing education through training and newsletters and during safety meetings, really, again, normalizing these conversations. And again, language matters. So the way we talk about mental health matters. Saying things like committed suicide versus died by suicide, or mental patient versus person with a mental health challenge. That's the difference between othering and empathy. And it may sound small, but it really signals whether your workplace is safe or stigmatizing. So be proactive and learning the best way to talk about mental health with your employees and in your workplace through trainings. And the last is openly discuss mental health in the workplace. So again, build it into the team meetings, put mental health on the same footing as physical health. If you do safety briefings, include stress and fatigue. The more we talk about it, the more we normalize it. And whether you're a leader, a manager, or someone who cares, be the person who starts the conversation. So be proactive. You don't have to be perfect. You just have to be real. Because every time that someone speaks up openly about it, it makes it easier for the next person to do the same. And that's really how we break the cycle of stigma. Stigma thrives in silence, but it really weakens in the face of compassion and leadership modeling that. Next slide, please. So research has found that manager support strongly correlates with positive employee mental health outcomes. The report found that workers with supportive managers report higher rates of psychological safety and are more comfortable asking for support and providing feedback. So the first is provide training and learning opportunities. 70% of managers have not been trained to handle mental health conversations, and only 50% of workplaces provide mental health training or workshops for leadership. So if your leaders don't know how to spot the signs of a mental distress, or they're not equipped to have that conversation, they're either going to freeze up or unintentionally do more harm. So providing that regular practical training to managers and supervisors to help them feel confident supporting their teams is crucial. So this might look like a mental health first aid or mental health impairment recognition training. Second, encourage employee-led resource and support groups. Again, with leadership setting the tone, modeling mental health support and mental health behavior. So checking in with people, using inclusive, non-judgmental language, and leading with empathy. Increasing access to care. So you can't just say mental health matters and then make it hard for people to access care. So look at your EAP, look at your benefits. Make sure your employees know about them. 57% of employees lack awareness of what's accessible in their workplace. And the last is promote mindfulness and stress management strategies. Next slide, please. So now we'll shift into the more practical tools of today's sessions, these tools and resources that we'll discuss next. Next slide, please. So this list represents a curated set of resources that employers, safety professionals, and HR teams can use. The first is U.S. Surgeon General's framework for workplace mental health and well-being. This framework outlines the foundational role that workplaces should play in promoting workers' health and well-being. It outlines 5 essentials to help organizations develop, institutionalize, and update policies, processes, and practices to best support workers. This framework really offers tools and language and strategies to help employers really bake mental health into the workplace rather than treating it as an add-on. The next is NIOSH's total worker health model. So this can be used to create and sustain safe and healthy workplace cultures. To align with the approach, workplace programs should address environmental determinants of health rather than focusing only and primarily on individual level intervention. The model really emphasizes that programs should only use the individual level interventions after addressing the organizational level fixes. So it encourages workplaces to integrate protections from work-related hazards with policies and programs that promote overall well-being. The next is NIOSH's WellBQ survey. So Caitlin talked about this a little bit previously, but it's a 68-item, 15-minute survey tool that really provides an integrated assessment of your employees' well-being. It can help employers identify and prioritize interventions to improve their workers' well-being. And the last is NSC's Workplace Wellbeing Hub. So our hub is designed to really centralize the best mental health and safety resources for professionals like you, whether you're looking for a sample mental health policy or a guide on using your EAP or a checklist of benefits that promote mental health. It's all there and it's all meant to be actionable. So it's organized and strategic and really designed for implementation. And it's meant to bring the best tools together in one place, updated regularly and backed by research and grounded in that total worker health framework and principle. Next slide, please. Next is mental health first aid training. This really gives your team the tools to recognize when someone's struggling and how to approach that individual with care and confidence without judgment. If you're trying to shift your culture toward openness and support, this training is really the first step. There are versions for supervisors and staff and general employees. The next is the Mental Health America's self-screening tools. This is great for employees themselves to really screen and see where they fall in regards to depression, anxiety, and substance use. It's really great as a early awareness and early intervention recommendation. The next is telehealth, behavioral health services, and mental health task force or peer advocate networks. So having a dedicated mental health task force or a peer advocate network is really great. Sometimes workers don't want to go to HR, they just want to talk to a peer. So this can make a huge difference in your workplace. Next slide, please. Your EAP service is really designed to support both employees and employers. So for employees, it should include tools that resolve personal concerns that may be affecting their health and well-being. But for employers and supervisors, you can provide services to really help them navigate through these complex situations, to learn how to support a distressed team member, how to handle performance issues without violating privacy or legal protections. So just remembering that it's not just for employees, but really equipping leaders with tools as well. Next slide, please. This is an extensive list of the full spectrum of challenges that your workers may be facing that contribute to mental health. And so just reviewing your EAP and seeing, does it offer these services? Ask your vendor how they're supporting these different domains and advocate for expansion where any gaps exist. The most important thing is make sure your employees know about these supports and that these supports are there. Next slide, please. Because the national average for EAP utilization is only around 3 to 6%. And it's not because the need isn't there. A lot of the time it's because the awareness is not there or the stigma is not being addressed in the workplace. So as safety professionals and HR leaders and program managers, we can really bridge that gap between the EAP and the people that need it most. So reintroduce your EAP at every level in onboarding and wellness newsletters and team meetings, include flyers and use it yourself. If you're comfortable using it and talking about it, that modeling matters and makes an impact. Next slide, please. So now we're going to zoom out and really look at the broader framework that ties all of this together, which is workplace well-being. It's not just one of these things, it's really all of these. It's the integration of physical safety, mental, emotional, and even social health. Next slide, please. So what does workplace well-being actually mean? So this quote from the US Surgeon General says it best: well-being means building safe workplaces that are also engines for health and wellness, that show workers they matter, that their work matters, and that they have the resources and support necessary to be safe and flourish. This framing matters because it really shifts the conversation. We're not just managing risk anymore, we're actively designing for well-being. And that's a big change from the traditional safety thinking. We're not just looking at physical hazards, we're looking at workload, psychological safety, inclusivity, fatigue, and mental health support. Next slide, please. So this is an introduction to NSC's Workplace Wellbeing Program. At its core, it's really built on the fact that you can't separate worker safety from worker well-being, and that includes mental health and substance use, fatigue, psychological safety, and it's grounded in the total worker health approach. We focus on research and resources and advocacy and collaboration, and our resources are designed to be used by safety professionals and operations leaders, employee committees, and workers themselves. Next slide, please. This is really a snapshot of what it looks like to work towards a truly holistic, well-being focused workplace. It's the gold standard, but it doesn't happen overnight. So just thinking of building this structure one at a time, each one of these elements is kind of like a pillar that holds up the whole. Next slide. So if you're having trouble figuring out how to get to that gold standard list, and again, these slides will be shared with you. I know we're going quickly, but I'm seeing that I'm losing time, so I'm just trying to kind of rush through them. But if you're having trouble going through that gold standard list, check out our Workplace Wellbeing Hub. As I shared earlier, this is really a one-stop shop to address the workplace well-being related risk in the workplace with policy templates and guides and toolkits. And we're actively working on building out the hub every day. So continue to check back because a lot more content and resources will be added just in the next few months. Next slide, please. So to wrap this up, the big picture is why this matters. Employee mental health is not just a side issue. It's not just a personal problem. And it's really a workplace problem. Mental health impacts the financial health of your organization, the safety of your teams, and the culture you're building every single day. So we've covered a lot today: the risk, the data, the stigma, the tools, the role of leadership, the responsibilities of supervisors. But if you take none of that away, it's just important to remember that addressing mental health in the workplace isn't just the right thing to do, but it's the smart thing to do. It improves retention, it reduces injury rates, it boosts productivity, but it's really a team effort. So starting from the top up and the bottom, the top down and the bottom up, and working from both places. So have your managers model it, have your safety professionals embed it, and your workers will feel more empowered to engage with it. It's really a whole organization strategy for everybody to take part in. Next slide, please. So really, it's education and awareness, making sure that your employees are aware of the resources that your workplace provides, building out that culture to make sure that they feel safe using those resources, and have your team know the risk, the resources, the expectations. So it's really increasing that access to treatment. If someone is struggling, they shouldn't feel like they have to jump through hoops or feel ashamed to get help. And if they do reach out, let's make sure that the system catches them with robust policies. So we really have to formalize our compassion into policies and programs. They tell your employees that we thought about this, we care, and we're prepared. And the last is really stigma reduction, which is foundational. You can't really change what people are afraid to talk about. So every time you speak with empathy and every time you challenge that harmful language, every time you model vulnerability, that's really dismantling that wall. And it really comes down to compassion and communication. So sometimes the most impactful thing you can do is just simply listen and to ask someone how they're doing and remind them that they're not alone. I think that wraps us up. I think Morgan will share a little bit about our resources and we'll do a quick Q&A if you have time. I'm so sorry for running a little bit over.
Yeah, no worries. Thank you both so much, Caitlin and Jenna. I see a lot of good questions in the chat. If you're able to stay on, we'll touch those. If not, you can always fast forward in the recording when you get it to get the answers. So a few great comments from people sharing their personal experiences. But a couple questions that we have are, the data is very good, but recommending a study to see about the psychological state of people post-pandemic, think that's great. Is there a recommended training for mental health first aid providers, specifically one that allows to train our employees? So maybe a train the trainer. I'm not sure if Jenna or Caitlin, you have an answer to that.
Yeah, there are a plethora of mental health. If you Google mental health first aid trainings, there are a plethora out there that are provided for really supervisors, employers, and employees themselves.
Great. Is the anxiety creating a distraction that leads to rising numbers of incidences? I believe this one was asked during your section, Caitlin.
Yeah, that's a really good point. And again, I touched on how there may be bidirectional nature of the relationship between things like anxiety and injury, whereas one can cause the other or it can go the other way. And absolutely, some of the symptoms of anxiety, like distraction, or can cause all sorts of cognitive effects that may affect memory, concentration, things like that, that could result in accidents.
Thank you. How would one professionally speak to management or HR if they feel stigmatized after returning to work from FMLA for mental health?
That is a great question. And I would use these resources as best as you can. I know that they do provide it from the employee lens as well on how to have those conversations with your managers. But I think being honest and open, it's really up to the leadership and HR and organizations to be prepared to have those talks. And that's part of this training, is providing supervisors and HR with the tools and resources they need. So they should be prepared, but there are trainings and information out there for employees themselves to guide them on how to have these conversations. And using some of the resources shared today, they do have sections that provide help to employees themselves.
You. And then I'm going to kind of tie two questions together. There was a comment made about how there's 23.1% of the US population who has a mental illness. Do we know how much is underreported, and could that be underreported because employees are afraid of being labeled if they report mental health issues?
Oh, 100%. Yeah. Research has shown that upwards to 50% of individuals in America are struggling either silently or have been diagnosed with a mental health illness. So that number is definitely a conservative number. It's only individuals that have been diagnosed with a mental illness, and it doesn't include the number of people that are struggling silently.
Thank you. So that is all the time we have today. We've already gone a little bit over, so our apologies. The recording and the slides will be sent out shortly after. And then we welcome you just so we can continue to do informative webinars and provide you the information you need. Please take a few minutes to do our survey that will come up after you close out and exit the webinar, or it will be in the follow-up email as well. So thank you all for attending today, and thank you again, Jenna and Caitlin, and Everyone have a good rest of your day and week.